That's great. Community is definitely very important right now. Obviously, like you were talking about about the COVID-19 pandemic, it's affecting everybody. How is it affecting the bladder cancer community? Have you seen any challenges that this population is facing because of the pandemic in particular?
Yeah, I think for bladder cancer patients and their families, just like any cancer patients or actually anybody else dealing with the disease, a non-COVID disease, during this time, it's an incredibly challenging time. Bladder cancer requires a lot of surveillance. And so depending on what kind of bladder cancer you have, what stage is your disease, and what kind of treatment is involved, there are a lot of questions and there are a lot of challenges right now. Some patients need to see their doctors on a regular basis to be scoped to see whether or not their cancer has returned. Some patients are getting treatment, maybe intravesical treatment into their bladder that has to be done on a weekly basis. There are patients who are getting chemotherapy. And all of this has changed during COVID because there's a risk benefit analysis you have to make as to, do you go to see your doctor? Do you go to the hospital for that scope at a time where things might not be quite as safe or as comfortable as they were in non-COVID times? So what this requires is really a close relationship with your healthcare provider and having them talk with you about this risk benefit analysis. There are many times that treatment can be delayed without an impact on your prognosis and your health. There are other times and for other patients that treatment needs to happen now, but I think that most hospitals as well as outpatient clinics and doctors' offices have taken all of the requisite steps to make sure that their patients are not unduly exposed to the risk of COVID by coming in for their treatments. But the doctors, and again, this is why you need to have a really good relationship with your medical team. They're coming up with really creative and new ways, maybe other types of treatment that they can do during the time when surgery is not yet allowed. So there are a lot of really interesting things going on, a lot of helpful things going on